Hello, in this video I'm going to be talking about turmeric. Is it good for you? Is it bad for you? What is its role in cancer prevention? And are there any things you should know in terms of cautions? Before I go on, I'd love to have you subscribe to our channel. We're always putting out new content. Don't forget to go to yerbba.com to get your personalized breast cancer report. What exactly is turmeric? Turmeric's a plant that's grown mostly in South Asia, but also throughout the world. And the part of the stem that's right below the surface has an active compound called curcumin. Curcumin has been shown to be helpful in treating inflammation and pain. It also may contain antioxidants, which can help sweep up free radicals that can cause cellular damage. Antioxidants are things like vitamin C and other things we get in food. And I'm speaking mostly now about dietary curcumin and turmeric. So these are things you eat in your diet as opposed to supplements. There is evidence that in some animal models, turmeric, or the active ingredient curcumin, may decrease the risk of cancer developing in cell lines. We don't have a lot of good data in human beings. There's also some concern, as with many antioxidants, that it may undo the effects of treatment, in particular chemotherapy and radiation therapy, both of which work in many cases through oxidation. So the antioxidant effects of turmeric can be useful long-term in preventing or maybe even decreasing the risk of cancer, but we don't want to expose people who are undergoing treatment that relies on oxidation, because that can undo the effects of all the treatment somebody is receiving. And we know this from a few good studies. If you have used antioxidant supplements or turmeric capsules when you were getting your treatment, it's very likely it's fine. What we don't want to do, though, is be recommending these things for people on active treatment. We do know that in the laboratory that turmeric may interfere with cell division, and that's probably a good thing, right? It keeps the cancer cells from dividing. It keeps that growth in check. And some of these compounds in turmeric may actually affect stem cells of cancer, which, not the stem cells in our bone marrow, but the sort of originator cells of cancer. So there's a lot of promise. At this point, we tend to recommend avoiding supplements, powders, shakes, and having the things that may be beneficial in your diet. That way, you'll avoid excessive doses of any of these antioxidants. So dietary sources of antioxidants, it is really hard to overwhelm the effects of chemotherapy and radiation therapy. And as always, a colorful diet, which curry powder, the active ingredient in curry powder is curcumin, is part of a healthy and colorful diet. So bottom line, no restrictions on dietary turmeric, supplements and shakes. As with almost everything, there's probably not a lot of reason to do that given the data that we have. And in people undergoing chemotherapy and radiation therapy, probably best to avoid. I hope this has been helpful. Don't forget to subscribe and go to yerbba.com for your personalized report. If you put a question or a comment below, we get back to you within 1 to 2 weeks. We do get a lot of comments, so please be patient. Thank you so much for watching.